Question. So let me then skip to the first session of today. As I said, health, extreme responses to extreme conditions. Marco Harari is here. He already got up. He's a medical doctor. He runs the Joint Research Institute on Climatotherapy for skin diseases at the Dead Sea, right here, Hadassah Medical Center and Dead Sea and Science Center. And he's talking about evidence-based therapeutic properties of the Dead Sea. So, Marco, welcome.
Thank you for the introduction. Shalom. I hope that we will have a few minutes to show you the types of evidence-based medicine that we need to be sure that what we say is backed by studies and by something that we can rely upon. I would like just before thank Mira to invite me again here. It was very nice to be here last year, and I would like to see you again here in order to be able to make some cooperation with you in the field of medicine. As you already heard from the chair of the session, I have some affiliation, so it is quite normal that I'm going to give you a message from the heart and not only from evidence-based medicine. I'm working here for 30 years, more than 30 years, and I'm very close to the Dead Sea and to what we can say about its properties. There is one publication written by one of the doctors who was the most powerful pioneer at the Dead Sea, Professor Sharon Sukenik. He was a rheumatologist, was born in Israel. He deceased a few years ago, but he succeeded to write a paper in which he answered to exactly the question that you asked me, Mira. Do we have evidence-based about Dead Sea properties? Is that really working? And maybe how it is working. Maybe it is just folk and just to see. So let us see what he writes. Of course, he wrote about psoriasis, and this is something that you are going to see a little bit more at the next small presentation that I have here. We are talking about skin disease first and overall. We are here in order to show you, I am here in order to show you that skin disease at the Dead Sea are incredibly improving here. As you can read, it is clear that the Dead Sea is one of the best efficient therapy for psoriasis and some other diseases. So more? Yes. So we are not here dealing about how it is working, maybe a little bit later, but it is clear that we have enough papers and studies talking about the positive effects of the Dead Sea, sun, very special solar radiation, and balneotherapy, bathing into these waters. Some questions were raised about rheumatology. People suffering from chronic joint disease are also improving in the Dead Sea. And especially rheumatoid arthritis, people with such immunologic disease like psoriatic arthritis, ankylosing spondylitis. And I have to remember here that there was no controversy for psoriasis, but about rheumatic diseases, it took me a little bit more time to show what I'm going to write to you. There is a Cochrane review. It was published in 2015, a few years ago. This review told us that, it's not very clear. You can read the slide. They were not talking about psoriasis, skin disease. They were talking about rheumatic diseases. And they say that the impression that we have that there is no relevant impact, there is no insufficient data, etc. So the review was written in 2014, published in 2015. So a lot of randomized clinical studies were published since, and I think that the conclusion of the Cochrane review have to be reviewed. First of all, we have this study. It is a study from Italy. The team was able to show that spa therapy, mud pack therapy, has a positive effect on knee osteoarthritis. You can see, for example, in this summary, that the mud pack have proven to be effective in reducing pain, reducing non-steroidal anti-inflammatory drug consumption, and functional limitation. All this was done in a randomized double-blind study. Another study was here also published recently by an Italian team. Again, a prospective, randomized, controlled, double-blind trial with a 6-month follow-up showed that the results are supporting the good effects of this kind of therapy for chronic pain. Another paper, Israeli paper, this one, it was in 2014. We show that patients receiving mud pack have a positive effect on the low back pain. Mud pack from the Dead Sea, of course. So again, we don't have the possibility to say that it is questionable. We have enough paper to show that balneotherapy, the use of mud pack treatments of Dead Sea waters or salt water, can have a positive effect. This is a paper coming from our colleagues from Turkey, in which they had, again, a crossover randomized trial with washout phase of 9 months. That means the patients were treated by balneotherapy, and then they were treated by a placebo. And they show that not only the improvement is here after the 2-week only spa, but the improvement can continue even 1 year after. So there is no way. I think, Mira, it is clear, and I hope that also for you, we have a possibility to treat chronic patients, chronic pain on rheumatology through a technique that's very simple, without side effects. Of course, we have to travel, we have to come to the Dead Sea. But again, in the times in which travel is so simple and people would like to come here, I think it is something that we should not forget. In fact, a lot of people are coming to us. This is a small evaluation of the patient that we have the last 10 years in our clinic where I'm working here, one of the biggest, of course, at the Dead Sea. And we see from Germany, Swiss, UK, USA, almost all the world is represented here. And I believe that it is something that we should continue simply. Here is about the indication, that means the condition that we are treating. Psoriasis is taking 50% of our activities. We have a large part of psoriatic arthritis and of osteoarthritis. Cystic fibrosis and atopic dermatitis are also represented in our population. So we can ask, what is climatotherapy in fact? So if I have a few minutes more, I would like to show you that it is a simple but very nice way to act on the immune system. We have the possibility to give to the patients here, yes, I think that now it is much better. We have a highly effective way to change the immune system of the patients. We show this already. We have no side effects when it is under medical supervision. And if you ask me how it is working, so I find two very old pictures. This is heliotherapy, the use of the sun, and this is balneotherapy. This was in French, les bains de Bourbon, d'Archambault. This was already in 1949, so we are not doing something very new. We are just using the same way that all the doctors were using. Heliotherapy, use of the sun, of the UV radiation, very special that we have here, and the salt of the waters of the Dead Sea. The way to work at the Dead Sea is very special. We are not alone. As you saw, we have a lot of patients. We have a lot of countries represented here. So from patients, disease research, climatotherapy is more and more precise. We can deliver to the patient a very nice and precise protocol of sun exposure, of Dead Sea bath. And we have more and more contact with the universities and the ministries of science and health. In fact, if I have a few minutes more, and I think that I have, we have the possibility to show that we are turning something here else. The nature is simply understood in another way. We have no time to do that in Jerusalem or Tel Aviv. We have the time here. Here we can expect to understand a little bit better. And this is the message that I want to tell you. I know that you are not all of you in the field of medicine. But the question is, in medicine, do we need still clinical studies? We have enough models, we have enough computing, analyzing. Maybe we don't need more of this. In fact, I would like to tell you that yes, we need them. We need them because in order to develop science, to develop medications, drugs, we need human studies. Clinical and human studies are essential to progress in the science. The research in humans is needed. We have to continue that, and this is what we are doing here, and I'm not alone to say that. You can see the reference here below. I think that now I have to explain to you why it is worth to do science at the Dead Sea. Why it will be good, for example, to have a connection with the Potsdam University and to have some studies together here. First of all, because the clinical changes are amazing. In a couple of weeks, sometimes a couple of days, people are changing here. Skin diseases, joint diseases, but also lung diseases. We have a real world condition here. We are not in an university. We are not in jail. We are here doing what people are doing at home. They are living in a hotel or in other places, and we are expecting and looking at their improvement. Close cooperation with very sophisticated research facility. You can see here what we have are, and of course we're here in extreme climatic conditions, so we can see what are the importance. Some example of what I say. Hypertension is changing dramatically. All of us, all of you, have less blood pressure now in their body. All of you. Not only the people that are coming and staying for a long time, but people after 24 hours are already with a reduction of blood pressure. It was already published. COPD. All of you are now breathing 8% more oxygen. How it can be? We all knew that we have only 21% oxygen in the air. But the pressure, the barometric pressure is different. So we have a different oxygen here. And it is exactly like the boiling point that all of you know, that we have the higher boiling point in the world here, so we can drink a very hot coffee or hot tea. The same is for rehabilitation. You can see a paper published in 2007 already about cystic fibrosis patients, about oxygen. Another thing, a brief stay may have physiological benefit for cystic fibrosis patients. Couple of weeks and they are gaining weight and they are improving the lung function. Again, we have not only dramatic changes very fast, but we have also here a treatment in real world. As I told you, people are living exactly like at home. They are not introduced in a very strict and framework study. No, they are doing exactly what they are doing. And of course, as I told you, we are close to the Masada Institute, in which we have wonderful opportunities to better understand what happened. Not only skin disease or joint disease, but also opportunities in the most important disease of the world: cancer, COPD, and diabetes. I can show you some slide about cancer. We have here shown in 2003 with a nice paper that we are reducing the exposure to the sun, and we are reducing the risk of skin cancer at the Dead Sea. We can even treat a type of skin cancer called mycosis fungoides. We have also shown that at the Dead Sea, people with heart failure are welcome. They are not only welcome, but they are also improving here. Again, due to the barometric pressure. Diabetes, the first studies that we have already published show that sugar is going down here. Of course, we have to take care of the kitchen of the hotels. That's always very plenty of sugar, of course. It's not yet arrived there. But we show that blood sugar are falling a little bit after single immersion in Dead Sea waters. All this has to be more and more examined, and we have to try to understand how it works. One of the big issues in the world today is epidemic. You know, all the countries have to fight the obesity. And at the Dead Sea, we have preliminary studies that I cannot show you today, but we show that UV radiation can be also a way to reduce obesity. So last, not the least, is the anti-aging, of course. You will hear about, surely, during the day. We can say that the specific UV radiation that we have at the Dead Sea can reduce the damage, the photo damage. And this is something that has to be studied. We have to continue. These are only preliminary studies. Just to show you a last slide about the disease that we are treating at the Dead Sea. Rheumatoid arthritis, psoriasis, Crohn's disease, gastroenterologic disease in which we have immunologic changes, and type 1 diabetes. All these diseases are virtually candidates for Dead Sea treatment or Dead Sea studies, let us say. So it is because we know that we have here an impact on the immune system. So I hope that I have convinced you. I hope that you will be able to have some contacts with people talking here about studies, no matter why and how. As I told you before ending, I would like to show you the second presentation just to explain to you that we are amazed by the results at the Dead Sea. I will take for you a small review of patients here. These patients, a patient from Germany coming from us here after a couple of days, you see, 4 weeks. The same patients went to us like this, and this is what we do. Again, it is a lesson of modesty because we didn't use any cream or any treatment out of the sun and the sea. A lady coming from Austria, coming like this, you see the difference. This is the back. You see wonderful skin. We are used to say baby skin. Another patient coming also from Austria, you can see the results, amazing. Again, a patient coming with excellent results. Again, I think that you have to take care of this. It is the time that we have in order to clear the lesions. This is what we call psoriasis gutated. It is very oftenly easy to clear with artificial phototherapy, but at the Dead Sea, in less than 1 month, we have a wonderful time. I'm just finishing here, showing the same results again and again. We have thousands of patients who were at the Dead Sea here for these results. I think that psoriasis is really dramatic. Yes, I hear this. It is really very nice to see the difference that we can have in patients. This young lady come with a very bad situation that is totally clear. I want to show you the last slide, with your permission, 1 minute more, about a young patient who want to, from us from Austria, I think. He was very, very badly sick with atopic dermatitis. We succeed to have a good improvement after about 3 weeks, and at the end we can really smile with him. Thank you for your attention.
Well, thank you, Marco. The obvious question is what happened between the Cochrane study and the evidence you're collecting. I think there's still some work to be done. But maybe there are some questions from the audience. I think there's time for 1 or 2. Yes, please.
Well, very impressive, Mark. I have a question. I know in the US we have a lot of problems in addition to diabetes and everything else with mental diseases like anxiety and depression. Anything that can be done for this type of patients?
I think yes, voluntary. I didn't talk about psychological aspects of the Dead Sea treatment. Bringing people here for 2 or 3 weeks, cutting them from their environment, having them to be with the program, being coached by professionals are the best way to improve their anxiety or their stress or any kind of disease, additional disease that they can have. But I have to tell you that properly, patients suffering only from anxiety or from psychological disorders are not treated at the Dead Sea, because we need a structure for that. We need psychologists, we need psychiatrists, we need people who are able to follow them in a proper way. So I'm back to what I told you. Patients with skin disease or joint disease or other disease that are treated at the Dead Sea and have concomitantly anxiety or other psychological disorders can be treated at the Dead Sea very efficiently.
One more. Yeah. 2 more. Okay.
Okay, Heinz Voller from Potsdam. Thank you for very impressive examples. But rehabilitation or secondary prevention lasted lifelong. And my question is, what is the structure of your aftercare after the people are?
It is a good question, because we are talking about possibility of cooperation here. At the Dead Sea, we can quickly, very fast, bring the patient in a quite normal condition. But we need the structures at home. We are not doing rehabilitation for such patients. I can tell you about a project that we have with Austrian sick funds. These people understood that sending patients at the Dead Sea once a year can be very efficient about the money that I can spare by using the biologics. So we have a study that just now will get out. We published that rehabilitation of such patients cannot be done in 3 or 4 weeks at the Dead Sea. The Dead Sea should be a way to stop the disease, to make a kind of a balance in the patients, and then we have to be they have to be followed at home. So definitely a good question. Rehabilitation at the Dead Sea cannot be done because we have only for a short time the patients here.
One quick question, one quick answer.
Are we out of time, or can I ask a short question? I just had a quick question about, have you made any attempt to separate variables when people come here? I mean, putting them in the Dead Sea water, or not putting them in the water, or just having them here, or having them come only to En-Gedi or Jerusalem, or, I mean, is there any attempt at separating variables?
So it is a short question, a short answer. Yes, we did it. And we know that if we are using only Dead Sea, we have only 20-25% improvement. Only sun, 70% improvement. Sea and sun, we reach almost 95%.